So this simple table is really to give you an idea of how we would map metrics. So we want to have a picture of the original state before we started harmonizing. So the construct could potentially go through four number of steps, meaning the different divisions and the different department heads that can go through all the way to the end. There's also a number of departmental decision points where I showed you the thin lines and the thick lines, so the potential of 5. So if we say on average there's a duration of time at each step, which is roughly 6 months or half a year, you can calculate total duration potential, which is about 2 years of time for that one particular item horizontally through the entire process. Now, if you add up all the other items like the cell line work, the purification work, characterization work, and formulation work, you'll end up with roughly 14.5 years to get to market, which is not unusual. But the goal for the harmonization will be to reduce the number of steps, to reduce the number of departmental decision points, ultimately reduce the duration total of time, and at the same time maintaining the highest quality work that we can do at all of this. So again, like the lean, we're not sacrificing value. We are trying to increase value through the removal of waste, so non-value contributing items. Here we see a chart that's very similar to what you saw in the original state. So this is what I'm calling medium scale harmonization and optimization. So within each division, under each vice president, basically, there was a desire to optimize and build in efficiencies under each VP. So this was the initial medium scale harmonization. It was itemized under VPs. It was easier to execute, got people used to thinking this way, and we can break down the problem step by step. So again, we're trying to simplify, in the sense we simplify the horizontally and we simplified vertically, but mostly horizontally. Uh, Vertically, we don't really have much room. The construct, the cell line, the protein purification, characterization, formulation is needed across the board. But from management point of view, we can simplify things. And under the VPs, what we see, for example, the construct used in discovery research and discovery therapy would be agreed upon prior to entry from early into discovery research. So the construct that's used at that step would be perfectly acceptable to the discovery therapy group. So there's no need to redo it once you hand it to the discovery therapy group from the discovery research group. So that's an easy example of where the harmonization works and you save time. However, as you see when it goes to development, they may not like the construct and they may make their own. So really what we find is a lot of harmonization horizontally that's happening under a particular vice president's domain. And in one case, when we go to protein formulation, the development group was in harmony with the discovery therapeutic group and discovery research group. So that broadened out a little bit. So this is just to show you how we are kind of expanding horizontally to simplify and to make things easier. And vertically, we're dealing with directors, people are starting to communicate with each other and gaining value and looking into each other's best interests earlier on. So here again, it's just a chart to show you how the metrics have changed subtly. What we see is a reduction in the number of departmental decisions, which we saw with the formulation. However, the number of steps didn't really change that much with this because we're really under a certain VP. It wasn't global. But we did see some change there in the decision-making process, which is very helpful. We do see a reduction in the time it takes by 1 year. Again, it sounds small, but we're going in the right direction, and it's just to give you an idea of how we're going about it. So here where we get to the full-scale harmonization or global harmonization optimization, we see these arrows are broadening in some cases from early discovery all the way to phase 1, clinical trials. And the protein purification one, where you see even though the cell line and the construct is acceptable through clinical phase 1, you will see that the purification component really is guided by what's useful for discovery therapy and development. But phase 1 and phase 2, they still may be different enough that even though we've got constructs that are acceptable from development, which isn't a group that's angled and aiming towards clinical phase 1, they may say that construct is good enough for the work that needs to be done to move things towards development, or in this case, and usually when it gets into development, it's going towards a IND, which is a regulatory moment. They still want to potentially optimize the construct or the purification process towards clinical phase 1. There still may be optimization in there that's really focused at large scale purification, meaning manufacturing scale, which is something you would never ever approach pre clinical phase 1 work. So that's why that's being separated. And protein characterization and formulation is something early discovery really does not take into consideration. But you do see that once it enters discovery research, it moves into clinical phase 2, 3, all the way across the board. So this represents a harmonization that's more global, almost fully. And the reason that some things are not global is really a structural item based on the type of work and the nature of the work. So it requires a review and a potential modification. Again, these modifications to put it into decomplexity and being harmonized is many of the questions they would have normally had have been answered already earlier on. The questions that they have, they really can't answer until they get past phase 1 clinical work for the construct and the cell line, or for purification until they get facing directly at clinical phase 1. So these are really situational, directional data gathering that can only happen when they're actually there and doing it. So these are structural and they are understood. But the number of questions that they need to answer are fewer and very specific, so it facilitates a streamlined and efficient program towards these new areas. You can also see vertically, by having things crossing the board, you can see that all the VPs are at least in communication with each other early on. So this is the pull system. You do it early. You have meetings where everyone that represents these separate categories are there at the table. So all of these critical inputs can be put in. And more importantly, as the program goes forward through early discovery to discovery research and discovery therapy, development, clinical phase 1, clinical phase 2, 3, if any problems arise in this process, because this part really does fit in with manufacturing. As there's an issue in a construct or a cell line or a purification parameter, as you're moving forward, the system will stop, everyone will regroup, and we will tackle those questions and potentially solve the problem then and there and move forward from there. Instead of waiting till you get all the way down the road and someone says that the protein production is too low, this is not good enough for manufacturing, go all the way back. And at that point, you're so far along, you may miss your window to recover. So the pharmaceutical company may be under pressure to kill the program altogether. So you really need to be solving problems as you go along. And this particular harmonization not only facilitates that, it makes it easier to see things are really streamlined from the beginning, and management groups vertically are working together in a harmonious global manner. Another aspect to look at is you see vertically things are made less complex, in that if you just look at the number of bars, basically at the discovery therapy column or group, you have basically all of the processes and the items dominated by decisions coming from development group, which is the red bar group, because they have the most knowledge around construct and cell line for clinical trials, and that can be spread out horizontally as early all the way to early discovery. And then when you move into protein purification, where the expertise of the discovery therapeutic group is most relevant, you would have them horizontally dominating from protein purification all the way down to protein formulation. And what you see basically is that two groups dominated all the decisions that need to be made, and therefore you have mostly red and blue, which is another way of decomplexing the situation in the final state or the full-scale harmonization. So the harmonization is horizontally and vertically. See, with the full-scale optimization, we see a significant change. Where with the mid-scale, we saw that, yeah, there was some harmonization that happened horizontally, but it looked like vertically there really wasn't much change. So we saw there was fewer changes in number of departmental decision points, and the duration of time didn't really go down. But when you're able to utilize the whole system to work together and to make harmonizing efforts, leveraging the workflow, and also decomplexing the situation, we harness the power of the harmonization. So basically we went down to 10. The number of decision points was really brought down to 10, basically a 50% reduction. This can be considered a reduction in complexity. And also the number of years gets dropped in half. And I can't tell you how important this is. This is a significant reality. Reducing the timeline of a protein therapeutic from 14 and a half or 15 years down to 7 to get to the point where you might be able to approach the marketplace is a significant difference. You're not only reducing the timeline by twofold, thus you're improved your productivity twofold. Your reduced cost, you've reduced lost opportunity time, because the time it takes to move forward, other competitors can move ahead of you. So you might be able to catch up and be competitive in places you were not before. Again, all of this is done not to reduce quality of product, but to hopefully keep it the same as it was, even with all these lengthy steps, but maybe potentially making it even better.